So the first thing really where this concept developed from is I'm not one of these corporate characters who've just appeared in the healthcare scene, and going around different NHS sites at the minute. Sometimes I have to convince people that I'm not a sales rep. I'm not one of these people that are trying to sort of palm things off on them. I really do genuinely have introduced this concept to try and help people and improve diabetes care. And really, when we talk through the story of where it came from, I hope that you also share that with me and understand the background of how it developed. So it is a simple solution that will assist in the improvement of diabetes care. Initially, it was developed as the EIO medical card, which stands for Emergency Information Online. And it came about after my mum went to hospital with sepsis in 2015. She was in Durham Hospital and she was very poorly. And as she was there, she was very confused. There was people coming in asking all sorts of questions to her, and we didn't have any answers. It was a weekend, there was no access to medical records, and other patients had difficulty as well. And genuinely, it was quite a scary time. And I've always been one of these people that have ideas, and I've never really acted upon it. And I thought, you know what, I'm going to develop something from this, which will hopefully help a lot of people. And I developed the EIO medical card, and we started to put that about to see if we could get some interest in it. And whilst we were doing this, it was picked up by a guy called Stephen Dixon from Sky News. And Stephen Dixon got hold of one of these, and he happens to be type 1. And Stephen Dixon then started to put us in touch with a number of people, but one of which was a guy called Partha Carr, who currently is involved with diabetes care with NHS England. And he kind of pushed it and pushed it and pushed it. And here we are 6 years later with a diabetes e-passport, which we've called it. And it's currently running a pilot across 7 NHS sites within England. The unfortunate part of this is because of the term, the e-passport, it does get confused with this whole initiative for insulin, for COVID passports and everything else that's happening at the minute. And realistically, the idea came about to take the concept from a paper-based insulin passport, which will help protect people, into electronic form. And it's something that hopefully can help an awful lot of people, hopefully initially within the pilot, and looking beyond that, hopefully across the UK, across the world, and let's move from there, really. So it's been exciting. It's been exciting, it's frustrating, complicated, confusing 6 years. But we're starting to see really people pick this up now and move with it. So I'm going to explain sort of how it works, what it looks like, what it does, what's on the system. It's a joint patient and healthcare practitioner approach. So it started off as completely patient-led. So people would put their own details onto their own profile. And now it's healthcare practitioner as well, where they can put in insulin and other details. And it gives it a little bit more credence when it comes to helping patients in an emergency. So it may be confusing at the minute after that background, but I'll hopefully try and take you step by step through it. So how it kind of came about with the diabetes side, we noticed a number of challenges in the diabetes world that came out of initially the diabetes Nadia report in 2017. And it came out that there was a lot of scope for improvements in diabetes care. And some of these percentages were quite scary when we looked at them. Medication errors, insulin errors. We looked at sort of 1 in 25 people with type 1 developed DKA whilst in hospital. There was lots and lots of challenges around diabetes. And Partha Carr and the NHS effectively laid down the gauntlet to say, what can we do with this? Can we take it further? Can we address these challenges? Can we do something that will help towards this? And statistics like 28% of hospital sites don't have a diabetes inpatient specialist nurse. 1 in 6 hospital beds are occupied by a person with diabetes. And there was lots of challenges also around people going into hospital with other complications, but also maybe had type 1 or type 2, and that was overlooked. So they may be going in for a broken leg, for example, but the fact they had type 1 was potentially overlooked. So there was lots of challenges. So we came up with this. So diabetes e-passport looks like a bank card. It's a plastic card. It's waterproof. It works worldwide. And effectively, it allows access to a profile via a smartphone, tablet, or a PC. And the profile can be updated by a healthcare practitioner as well as a patient when required. So lots of information can be stored about yourself in general, as well as information related to your diabetes. We also felt it was important to have a timestamp on there so that when the information was scanned, it would give an accurate representation of when it was last updated. So this is what it looks like. So I can talk forever and it might not make much sense, but this is the central system. And this is what we built for the pilot. So it doesn't look the bee's knees at the minute. So we made the conscious effort to get the functionality working, to prove the concept. And the idea is that we will build the nice, colourful graphics and everything into it as time goes. So at the minute, each trust has access to their own patients. And as a healthcare practitioner, they can go into a patient's profile or create a patient's profile and then give the patient the actual diabetes e-passport themselves. So all of the patients will appear at the bottom here. And when they go into the profile, there's a horrible image of myself there, looking smart with a waistcoat on. This is what the profile would look like. So you've got a general section with allergies, GP details, and medical conditions. And realistically, this is what was initially on the EIO card. This was about being general, giving people ideas that would help them in an emergency. We then built a diabetes section and allowed uploads as well. So where the NHS have found this useful is they can choose to upload images of feet, for example, ulcers. They could choose to upload general information that will help a patient in an emergency. But also patients can choose to upload their own information as well if they wish to share it. So everything that's built here in the profile, the patient gives access through terms and conditions when they first sign up as well. So in the diabetes section specifically, you've got a hypo treatment box, which allows you to tell people what your condition is in an emergency. But the powerful part of this system is the insulin section. Now, the insulin section is edited by the healthcare practitioner. It's got a timestamp on the top of when that was last done. And when they select an insulin name, it picks out the image that is associated with that insulin as well to help reduce insulin errors. Now, it sounds such a simple thing, but as we've seen from the stats, it's quite a high problem in England in terms of insulin errors. But also the amount of people that we've had discussions with across the NHS, including patients, that have said it's quite easy to get confused between the colours of boxes and pens and Novo Rapids and Novo Mix and lots of different titles that are associated with insulin. So this links the image with the insulin name. The information isn't in here, but it's got you can put dosages and things like that in there as well. But the idea behind this is that it would help the patient in an emergency. Moving down the profile, we've got a diabetes tests and annual review section, which allows you to put a healthcare practitioner to put in information around HbA1c, cholesterol levels, and so on. Lots of different opportunities to put things in there. And what we've said to the NHS pilot is, you don't have to put things in there you don't want to. So it isn't the whole profile doesn't have to be filled in, but fill in the sections that you feel that will help the patient, and encourage the patient to fill in the sections that they want to manage themselves with as well. Because the diabetes management element of it is quite important for someone to take control of their own condition. And we've had loads of discussions around that. And that element of things, this will really help with that, hopefully. The diabetes foot examination section, we've got the opportunity to put images of the feet up there as well. If it's an active ulcer, if they're at risk, if they're being seen in the foot clinic, for example, and also the dialysis section as well. These sections were developed for the pilot, but there's nothing stopping these sections being developed further, extra things being put into them, for example. And we've tried to keep it as simple as possible for both the patient and also the healthcare practitioner, because we're conscious that they don't have a lot of time on their hands when they're meeting with patients to fill bits and pieces in. So the key to this is the insulin section, and then beyond that is also the patient assisting with the development as well. We've also got diabetes complications, where we could potentially move that in towards an education section. Diabetes consultant contact details, the specialist nurse contact details, and the section on diabetes pregnancy. We're also looking at potentially putting a diabetes foot specialist in there for the contact, but we've tried to restrict and be careful about what we've put on for the trial, for the pilot, just to ensure that we're really targeting key sections. Otherwise, we could go too far with it at the minute. So how it works is the healthcare practitioner and the patient creates and populates the profile online. It's activated using a code from the back of the physical passport that then links the card to the profile. The passport contains an NFC chip, so it's the same technology as used in contactless cards for banks and Oyster card, for example, as well as a unique QR code dedicated to that passport itself. And if the passport is placed on a smartphone or tablet with NFC, or the QR code is scanned, or the code is entered to a section for healthcare practitioners, it brings up the profile and it allows people to access the information that can help them in an emergency if they can't speak, they're unconscious, if they're having complications. And like I said, the card is waterproof and it works worldwide. That's what the card looks like. I've put a crazy drawing together of how roughly it works. So the system itself connects to the cloud, and therefore when the card is accessed, it accesses the cloud. A really simple concept, and it brings the information up into a device. So hopefully it'll help a lot of people. A lot of information around the benefits. I'm not going to sit and read through these, but there's lots and lots of things that this can help with, from anything from accessing next of kin information. You've got insulin safety, which is the key area we were focusing on, providing a safety net for the patient, providing medical conditions and information regarding medication. One of the questions we receive a lot is, will this be acted upon directly? So the scary part of it is, will people pick up the medication and the insulin and say that's exactly what they need? And it's not for that. It's for really giving a guide, giving an accurate representation of what the background of that patient is in terms of insulin or in terms of their condition. It's patient-led, but we've got a healthcare practitioner part to it now. A patient can make amendments to it as well as a healthcare practitioner. Monthly email reminders. What we don't want to do is get into the trap of sending lots and lots of emails to people. We remind people to update the profile, keep on top of it, and it's about receiving education to the condition. It's about empowerment, ultimately. A patient can access diabetes management in terms of dosages, complications, changing the healthcare practitioner contacts, and it stores information on existing medical conditions, interactions alongside the diabetes as well. The one area I really wanted to focus on with the NHS is around potentially mental health, surgical wards, learning disabilities, and the fact that not everyone's the same. We all come from different backgrounds. We all have different needs, and we want people to go into a hospital or into a health practice and be treated for everything. And realistically, as human beings, you could break your leg, break your arm, and that is the main focus. And what we want to do is raise awareness that if you're carrying one of these passports, to be aware that you've got diabetes, and there's information there that could help as well, because that's where a lot of the errors occur in hospitals. The support so far, we've had an amazing amount of support from diabetes specialist nurses, consultants, patients all across the UK, and they've been really interested in this, and they're really backing the pilot, which is going to last about 6 months to 7 months. And the idea is, the objective of NHS England is that if it's successful, it will roll out across the whole of England and possibly the UK. The objective for me is I want the world to use this. This would be a fantastic opportunity. We could develop this in different languages and go beyond where we are at the minute. Stephen Dixon is a massive advocate of the card as well. We've had groups like IPAG, which is the insulin pump awareness group, and others in the diabetes community that really backed it. One of the challenges for us at the minute is getting awareness out to ambulance services. We've got the North East Ambulance Service on board. They recognise the product, and they're currently planning a campaign for all the ambulance staff. I really need this to sort of make awareness as much as possible across ambulance stations. In the pilot sites, they are creating awareness through post campaigns and staff training as well. So it's David versus Goliath, but it's something that could help so much. Support required to raise awareness of this as much as possible. Social media, talking to friends, family, colleagues, showing your support for your local trust to adopt it once the NHS England pilot is completed. And the future opportunities, realistically, is to get your input into it as to where we could go with this. Like I say, we're not a massive corporate. I'm literally a one-man band with a developer who's gone ahead and done this. We've gone on a shoestring budget to develop this for the pilot, and realistically want to try and develop as much as can within our means. But the opportunity to develop this further, we could go crazy and have live tracking from diabetes devices in there that flag up errors and flag up information, and beyond. It's the possibilities are endless with it. In summary, it's a patient-led solution with healthcare practitioner input within inpatient care, and it can help an awful lot of people with insulin errors. It can provide valuable contact information. It's a valuable form of identification in an emergency. It's got the massive potential to improve holistic diabetes education, and we have the flexibility to work in partnership to produce a real complete solution that can be ongoing and in terms of development. I've put my Twitter on there, which is EIO Simon. I know I'm going to answer some questions shortly, hopefully. If you have any questions after this, feel free to tweet me on that. I'm also on LinkedIn, if you search for Simon Blood on LinkedIn. So hopefully I'll be able to take some questions if you have any.